the next talk. So he has been patiently waiting at his computer, and I'd like to introduce Stefan Acke from the department Zorg Flanders in Belgium, and it's the Flemish governmental agency for health and well-being, and he's giving us an insight on the environmental health impact simulator, and we're very much looking forward to this talk. So
Yep, thank you, and good afternoon. Yeah, I'm sorry I can't be with you live in Eupen. Never been there, shame on me. And it also seems a very nice attic you're on. I'm jealous. I'm just in a big office center in Brussels at the moment. I'll start sharing my screen. Yup. A health impact simulator. I first have some slides just to tell you who we are. Yep. Department of Care. We don't exist very long, only since the 1st of June. Well, two big entities of the Flemish government have merged together. So we're now Department of Care. I am working for the division of preventive care for the team environmental healthcare. All the translations in English I made myself. They're not officially yet. We haven't had time for that one. So the team environmental healthcare, it comprises a lot of programs or teams we are working on. Also indoor health, but also clean drinking water. I'm working especially on healthy public space. Of course, we cannot do that alone. We're part of a bigger Flemish environment and health network, in which the Logo Limburg is also a part. And yeah, we also sponsor euPrevent, for instance. So we don't do things alone. It's health in all policies. Yup, and even bigger than this. So the environment health impact simulator, which I want to talk to you about. I'm first going to describe it in my own words. You saw some in the former presentation. There were pollution concentration maps of Atmo Street presented. They're available in Flanders also, of course. Well, we thought, you see these concentrations, and it's just measured in micrograms per cubic meter. Why don't we try to translate them in health impact measurements? Not measurements, and health impact numbers. So that's the big task we put ourselves, and we paid Vito to do the translation. So what does the EHIS do, the Environment Health Impact Simulator? It calculates the exposure to air pollution and noise pollution, but for noise pollution, we only have data from road traffic. We translate it into expected health effects and health costs. They're also in euros, and we map it. This slide, I'm going to walk you through it. It's important to know what steps the tool takes. So before I show it to you, you know what's the background of it. It's important to have it in your mind. So we start from the existing yearly averaged modeled environmental stressor maps, like the upper one is for nitrogen dioxide, but also for PM10, PM2.5. We look at the existing maps, their yearly averages, and existing maps. So that means we always look in the past. For air pollution, and there's also a map, but the most recent one is from 2018 for noise pollution from traffic roads, and it has not been updated yet. So that's still the most recent one we have. The yearly averaged noise parameters are LDAN, dus the day, evening, night noise, yearly averaged, and also L-night, the night noise. Above these maps, we lay another map with population data. Who lives where? And what's the age distribution of the people living in that region? So we that gives us exposure maps for every statistical sector. What is a statistical sector? It's geographic unit in Belgium on which it's smaller than a municipality, and it's kind of the bigger neighborhood. It's the smallest geographical unit in Belgium in which a lot of socio-economic and other data are collected. So it's, for instance, important to know the age distribution in that area. When we have these exposure maps, we put the dose-response relationships above that, the internationally sound dose-response relationships. So for that age category, so we can calculate what would be the attributable amount of cases in that statistical sector due to exposure to air pollution or to road traffic noise. We've gone one step further. We've calculated the costs for every health endpoint, and we can also give these, translate these health impacts, modeled, calculated health impacts into euros. But beware, there are huge margins of uncertainty. Every further step you take, it's another error, margin of error that's added to the end result. So where can you find this tool? On this link. So Zorg en Gezondheid, the Agency for Care and Health, doesn't exist anymore. We've merged together with another entity, and we are Department of Care, but the link is still this one. It will take some time before it will be another internet link. On this link, you can find the infographic and another link to a more complicated version. Today, in these 20 minutes, I'm going to take you to the easiest version, the infographic. But beware, stay focused, because you have to keep your mind with it, or you will, if you don't, you can misinterpret what you see. So I'm just going to show some, I'm not going to the tool itself, you can do it, but sometimes it's a little slow because it's very big calculations that run on it. So I'm just showing you some screenshots, but it's just the same if you if you use it. What you see is the infographic. We start with the the map of Flanders, and you see the 300 municipalities in Flanders. So beware, the tool is only available in the Dutch language and only for the Flemish region. That's a matter of budget and of legal restrictions. I'm working for the Flemish government, so yeah, we may only put money in yeah, Flemish things. So also beware, in this infographic, only the most recent year that is put in the tool is showed. Up to now, it's 2018. Later this year, we will add some more recent years, but what you can still see in the infographic is 2018, also for air quality. In the tool, we in the infographic, we show only population weight results. This means the numbers you see are for for every 100,000 inhabitants of that age population. So here is selected the stressor nitrogen dioxide, the number of expected cases annually due to the exposure to nitrogen dioxide in the year 2018 averaged. These numbers you see here, for instance, the upper one, it's small for you to read. I'll read it. It's nitrogen dioxide, asthma, number of cases caused, new number of cases that year for children between 0 and 19 years. And this is the number for the average of Flanders, because I haven't not selected a city or a municipality yet. That's 154.7 for every 100,000 people living in Flanders. Okay, what you see in the map is a color gradient, and the color goes, and that's for the color gradient and every other visualization you choose is the same color gradient. The worst municipality or statistical sector you select, the worst one is dark brown. It goes over something gray to dark blue. Dark blue is then the best one. Also beware of the difference between the median and the average. It's important to interpret the what you see here. For instance, the gray bar in the middle of all these things you see here is the average of Flanders. But if I click, for instance, on Hasselt, it's situated here, or when I enter it, gemeente municipality, I enter Hasselt, then it shows me the map of Hasselt and the numbers of Hasselt. We're still looking at nitrogen dioxide, asthma caused by nitrogen dioxide in the year 2018 for the age category 0 to 19 years old. We can expect that year 162.2 cases of asthma for every 100,000 inhabitants in Hasselt for that year, caused by exposure to nitrogen dioxide. In the lower part of the map, you see which are the worst statistical sectors. Here you have an idea of how big is a statistical sector. it's not always the same surface. And where are the best statistical sectors for this stressor and this health endpoint? On the colors, you can see that Hasselt scores for every endpoint of NO2 worse than the median municipality. And here you see the statistical sectors of Hasselt, where are the which are the worst to the best, and in the middle is the median statistical sector of Hasselt. I go one step further, and I will push not on the expected number of cases that year, but on the euro per year, and it has a little different rate. You see that mortality is the biggest one, because in our calculations of costs, mortality costs a lot to society, more than having asthma. So having asthma, there are dose-response relationships in literature for the children up to 19 years, and there are dose-response relationships calculated for adults from 30 to 74 years old. So two possible dose-response relationships. These are the numbers in euro that you can expect. So, for instance, the upper one is the example I used in the other visualizations also. Asthma costs about a little less than €500,000 per year for every 100,000 children in Hasselt due to exposure to nitrogen dioxide and the asthma they're getting from it. It's a number with a big margin. So I can, if I click on all pollutants, I get an overview of the, it's still in euros per year, of all the expected effects I can have in Hasselt. And here are the numbers. So the biggest ones are the ones you can die of. So mortality is calculated, but also ischemical heart diseases. Well, the chance is very big that you die from it, and mortality is also actually calculated in it also. If I click on expected numbers, yep, yeah, then these it's another image we get here, still from for Hasselt, but which is the biggest one. Noise. The three upper ones are noise. Noise, we have three health endpoints calculated. So ischemical heart diseases, but also sleep disturbance and highly annoyance. And they're all from people of 20 years and older. So if you look at number of cases, then noise, it's responsible for the biggest number of cases that are affected by it. But the costs, the health costs are lower. If I go one slide back, they are lower than those things you die from. For instance, the biggest one here is exposure to PM 2.5 where you can die from. Yeah, so, and beware that these are all numbers calculated for every 100,000 people of that age category. So I'm still showing some the example of Hasselt. In Hasselt, they live only 77,000 people, but they're not all from the same age category. So the real number, if you want to look at the real numbers, you can see it in the basic tool, not in the infographic. There will be a little different, but yeah, okay. Yeah, and there is one another button here. If you look at without sound, then you see the same all the air pollutants and their health effects, but the bars show a little bigger because yeah, we don't have these big bars of noise on the screen, so it's easier to look at the rates of them. So that was just a little look at what the tool does. There are some future plans. Of course, we're going to update with recent years for air quality. We don't have more recent years for traffic noise. We also want to visualize the share of air pollution and road traffic noise in the total burden of disease for every health endpoint. Because well, if you look, for instance, one of the health endpoints is diabetes. If you're exposed to nitrogen dioxide, you can get diabetes from it. But there are other bigger risk factors where you can get diabetes from. So we want to show that share of air pollution and road traffic noise also in the total of the health endpoints. And yeah, those sponsor relationships, they're about 5 years old, I think. And we looked at what can we use, what is sound enough to use. We're gonna do an update of that also. And that's for the far future. A dream is, yeah, it would be better if we could put some scenarios in it. So we have these air quality maps, always looking at the past, but say we can take some action and ameliorating the air quality by factor, I don't know what. What would our health gain be? But we're not there yet. The tool is not fit yet for that step. Okay, questions. I'm gonna stop.
Thank you very much for this very nice talk, and it should give us enough material for a nice discussion again. So, are there any questions or comments, Stefan? Yes, please.
Thank you for the presentation. I have two questions. The first one is about the noise. Why did you take LDEN and then L night? Why do you have 2 times the night measurements that are taken into account?
No.
That's my first question. And my second question is about the Telra network. Do you know about this network of camera that counts the traffic in the street? It's pretty widespread in Flanders. And could you use it to estimate the noise related to traffic?
Yep. Clear questions. Why did we choose Alden and Al Night? Well, those are the two parameters, the only two parameters that are available on a very big scale of Flanders. They also have to be reported to Europe for the environmental noise directive plans, and for these two noise parameters, the WHO, the World Health Organization, has those response relations. So LDEN there's those response relations for LDEN. So that's the daily averaged noise exposure for annoyance, and the all night is used for the sleep disturbance. Yeah. Then the evening night, actually in the formula, if you look at it, the night gets a punishment of 10 dB, and the evening hours get a punishment of 5 dB. Well, it's actually calculation of, but both parameters are only available on a yearly average. Yeah. Yeah, we're aware of those ANPR cameras you're talking about. The problem about the measurements for road traffic are actually on a policy level. The map we used, it's made it's been made possible also by the Flemish government in 2018, and they used a method to calculate measure, well, based on measurement of course, but all the small roads also in the little villages were calculated through in a way so we could get how do you say, a map that's covering the total of Flanders. But the methodology that was used in it is different than the methodology that is used in the noise maps that we have to make to report to Europe. The methodology in those noise maps is very complicated, and we could not run it over the total of Flanders. But the problem on the methodology of the noise maps that are needed for Europe is that Europe only asks a calculation of the biggest roads. So it's with 10,000 passages of 100,000 per year, or I don't know exact the number. So all the small roads, they're just white blank spots on the map. And the problem is that there were two maps available. But the map used for Europe, it has some legal legal obligations on it. You have to make noise action plans. So we make on these maps based for Europe. Oh, near those big roads, we see those people are exposed to too much noise. So we will take some action for them. But if people look at the other map and see, hey, yeah, my house is not on the map for Europe, but it is on the map for that you calculate on the other way. Why don't you do anything for me? So yeah, it was difficult to communicate. Yeah, there's too much uncertainty on these maps, and we don't have to do anything on it because it's not a European obligation. So it was difficult for the partners of the other department to have two different noise maps. But yeah, if we want to calculate it, the health effects for small villages, small municipalities. Yeah, we wanted to use the map that was covering the total of Flanders, so we chose for the other one. But well, there are discussions running, and I think in a few years we will manage to have an update of the totally the covering map of noise. Yep. Whoa, that was a long explanation. Yeah.
Complicated matter. So.
Yeah. It's yeah, policy matter. Yeah.
Sure. Yeah. So any other questions? Maybe one from my side, because you mentioned, yeah, I'm here on the other side of. So
okay.
you mentioned that of course you're paid by the province of Flanders and you're doing it for Flanders, of course. But of course, what you're doing is also interesting for probably other regions in Belgium, Wallonie, but also in the regional context here, what we are meeting here for. So do you see any possibilities, might be a difficult question, but any possibilities to expand what you're doing for Flanders, maybe in a European context or something, to also to the other regions, Belgium, but also Netherlands or Germany?
Yeah, well, we've presented these things, this tool to the European Environment Agency, and they were also interested in it. But to run such a tool for entire Europe, well, it will take a lot of calculation capacity. I mean, it runs on our servers now, and sometimes when a lot of people use it, well, there are other tools running on that same server. The Zorg Atlas, it's called, the Care Atlas. A lot of tools are running on it. Also around, well, it was sometimes on the edge of crashing during Corona, because the Corona COVID infection rates were presented on it. The vaccine rates were presented on it. It was sometimes on the edge of crashing. So if you want to run this kind of tool for an entire Europe, well, yeah, maybe we'll have to wait some IT evolutions also to make this running. But I had some questions myself that I'd like to share with you. So you saw what the tool can do. How would you use this information to change something in the field, or what could be better in it? Those are some general questions I'd like to ask you, and this was my closing slide, but you'll get it with my my contacts. Yep.
Yeah. Thanks. So I forward the questions into the group. So anyone has a comment on that? So how could you use it in your region, community, or what could be done? What's missing? What could be improved?
Yeah, if you had these this information, yep, because yeah, we can make the calculations to health, but there are other policies, other how do you call it, policy domains that have to take take the actions. I'm working for the Minister of Health, Public Health, but yeah, if I want to change something on mobility or anything, it's it's another political responsible that we have to address, of course.
can this be used for city planning, for instance?
Mhm.
Is this EHIS tool actually publicly available, like citizens
Yeah.
can just easily access and have
Yeah.
the information?
Yes, indeed. Yeah. Yeah, it's publicly available. So the link is on our website, and you can look at the infographic there. You can also, if the infographic is too easy for you, if you want to dive a little deeper in it, the basic version is also available. So there you can see the numbers, the absolute numbers, so not divided for every 100,000 inhabitants. But then you have to think, yeah, if I see a lot of people, a lot of health effects, is it because of there's a lot of air pollution, or is it because there's a lot of people living there? You have to make the interpretation, but it's available, yeah.
But this can definitely be used for city planning.
Yep, and the logos they refer to it if they step to yeah, to municipalities to talk about public health and public healthy spaces. They use it. Yep.
Great. Any further comments, questions, or answers? Oh yeah, please.
Maybe one. In many platforms, at least in the PM Lab platform, it was like that, but I know it's pretty general. You can see the results, but you can't access them. You just don't have an API to recollect the data. Is this something that is possible via your platform?
I'm sorry, an API is a term that I'm not familiar with.
Or a web service or anything to download the data and reuse